Welcome to Next in Health podcast. I'm Jenny Colapietro, PwC's Vice Chair for Health Industries, working across pharmaceuticals, medtech, payers, and providers.
And I'm Igor Belokrinitsky, a principal with PwC Strategy End, where I get to help leading health organizations with their strategies and operating models. And one of our favorite topics on this podcast is how health organizations, that includes health insurance companies, hospital systems, life sciences companies, technology companies, nonprofits, how they keep trying to solve these really complex problems of affordability, of value, of quality, of health equity, and how to solve these problems. They're coming together into ecosystems where they're joining their capabilities, they're joining their data, and they go after these really complex problems. And to do that, they have to think about technology differently. They have to be more digital. And they also have to adopt this more product-oriented and agile mindset and a way of doing business. And we talk a lot about this, but we don't just talk about it. We as a firm have put our money where our mouth is, and we have been over the years building a big range of products and platforms to be a part of this massive effort to improve quality, to improve equity, to improve affordability of care. And today with us, we have Rachel Moore, a director in our digital practice, who has been leading a lot of these efforts. And so she will be telling us about what's happening in this space. And so Rachel, very excited to have you with us. Welcome to the podcast.
Great. Thanks so much, Igor and Jenny, for having me today. I'm really excited to be joining you both to talk more about the power and impact of technology, as well as focus on that product mindset across the healthcare industry. In fact, as you mentioned, I literally wake up every day thinking about this here at PwC.
That's fantastic. And we appreciate you doing that and appreciate you being with us today. And maybe let's start with just your journey. How did you come to be in this role? And then maybe just tell us more about the role as well.
Yeah, absolutely, Igor. So as you mentioned, my name's Rachel Moore. I'm a director out of our Philadelphia office, and I have the unique opportunity to serve as one of our PwC portfolio leads, supporting all of our healthcare products, as you mentioned, within our P&T digital practice. I'm actually relatively new to PwC. I just celebrated my 1-year anniversary. I made the big decision to transition from industry back to the consulting world following a long and successful career at a large pharmaceutical company where I spent over 18 years. While there, I held many different roles across many different areas of the business, from procurement to legal to compliance to finance to IT and to global shared service, and the list goes on. But I really found a passion and kind of a niche in designing, developing, and implementing large-scale technologies or capabilities to support our global organization as my former employee really began to embark on their technology journey. I ultimately, though, decided to make the shift to PwC as I wanted to take all of the experiences and the lessons that I had learned and I had built over those many years and help apply them more broadly across more organizations. I was specifically attracted to PwC, as you mentioned, because we really are investing heavily in our products business, but also because they've created a culture or a mindset really of human-led, tech-powered, which really resonates with me. So, as I mentioned, it is my job here at PwC to continue to evolve and drive our existing technologies and plan out the strategy and roadmap for them, but also to help prioritize and develop new technologies and ideas as we identify new opportunities across the healthcare industry.
Well, Rachel, we're certainly happy that you've joined us and come on board. And as we hear the feedback through our CEO survey, our cloud and digital survey, and just what we're seeing generally in the market, we expect this to be a big year in digital transformation as organizations move towards being digitally savvy and more product driven. Can you tell us a little bit more about the industry outlook that you see? What are some trends that you're seeing?
Yeah, perfect, Jennifer. Well, I think we can definitely all agree that the digital age is most certainly upon us. We can take a look at our daily lives and the dependency that we have on technology. nobody could argue that technology basically affects almost every aspect of our daily lives today. Everybody has some sort of digital or technology that drives us, from mobile phones to computers and so forth. So I think it's inevitable that companies equally have to adopt these new ways of working and ultimately technology in order to continue to evolve and succeed. And the time is really now. But before we kind of dive into maybe some of those trends, I think it's important to reflect again on some of the significant challenges and external pressures currently facing the healthcare industry, which has really led us to where we are today. And I know, Igor, you mentioned a few of these when we started the call today, but I know obviously we have rising inflation, looming recession, which all companies are closely monitoring and potentially planning for. Chronic resource shortages, which were probably exacerbated by the pandemic, but of course are still persisting today. Financial challenges specific to the healthcare industry. We have affordability challenges, high cost and rising costs of healthcare combined with some of those equity challenges that you mentioned. We have evolving and increasingly complex regulations and more regulatory enforcement that we're seeing, a continued need for transparency. All of this, again, is really leading to that need for organizations to transform how they leverage technology and manage digital capabilities in order to overcome these challenges and ultimately, hopefully, to thrive. I think if successful, the aim of leveraging these technologies for organizations is to continue to gain those efficiencies at scale, to introduce simplifications, increase compliance and transparency while reducing costs and providing a better user experience for both not only internal but external stakeholders. Ultimately, I think we all have to look to do more with less. And by less, I really mean time, money, and resources.
It's a really helpful context, Rachel. And let's get specific. You've been sort of teasing and mentioning these products that you're managing for the firm. Perhaps you could give us a sense and give us a little bit of a tour. What is this portfolio of products that you're managing? What are some of the items in there that you're really proud of?
Absolutely. So PwC has and really continues to develop some truly innovative solutions within not only the healthcare space, but really across many other industries as well that solve for the critical challenges faced by today's society. We offer a wide range of solutions, including, I'll talk a little bit about some of the full-blown products that we offer, but we also recognize that sometimes products are not the only solution to solve challenges. So we also offer smaller module components or assets or even accelerators that companies can take advantage of to further progress their technology journey, depending on where they are in their own maturity digital life cycle. So from a pharma and life sciences perspective, I'd like to highlight a product that is actually launching in the coming weeks called Flex Connect. We're really excited to launch this new product because it's helping to solve a critical issue that is faced by pharma and other life sciences organizations today, which is access. We are all increasingly busier in our day-to-day lives than we've ever been before, especially the healthcare providers, which is really resulting in the need to identify a simpler, quicker way to communicate and share critical content between the pharma companies and the HCPs. So instead of resisting this change, which we believe we have historically done, we're utilizing this product to help pharma and other healthcare organizations embrace it and to enable them to engage with HCPs using commercially available chat apps that they're probably already using in their daily lives today. So again, to get easy access, but all while enabling the ability for organizations to do this in a compliant way through enabling access to all the interactions and data to support our company's monitoring and detection activities. More products in the pharma and life sciences space, we're continuing to evolve our Compliance Central suite, which is actually a suite of 3 different products called Interactions Hub, Transparency Hub, and Risk Detect. And these products also help organizations to solve for critical challenges that face the pharma and other medtech and biotech companies, some of which could be considered some of the riskiest activities across the space. So if we start with Interactions Hub, this is a product that was developed to support the end-to-end engagement management with critical stakeholders like healthcare professionals, healthcare organizations, and even patients. So there are a myriad different reasons why pharma and other life sciences organizations require the need to engage with critical stakeholders, from ad boards to steering committees to speaker programs to even grants or sponsorships or expanded access, and the list goes on and on. So this product helps to manage the end-to-end life cycle of those engagements, all the way starting from needs assessment or initial intake, through screening if needed, through contracting, all the way through execution, logistics if needed, again through payment and closeout. That then nicely leads into Transparency Hub, which equally solves a critical issue that faces all of these same organizations, which is the ability to solve for the evolving global payment transparency requirements. So today, regulations or codes or laws exist across about 46 different countries in which our pharma and life sciences organizations must meet those obligations. So Transparency Hub enables us to combine all of the data, not only from the engagement management perspective, but also from other critical sources across the company, including all of their external third parties, and applies different logics and enables configurations to then provide the ability for the client to be able to generate all of the necessary reports in local language, in local format, in order for them to be able to successfully meet all of these regulations. This, of course, very nicely ties into the third pillar of the compliance central suite, which is Risk Detect. This supports monitoring execution for companies while seamlessly integrating key data sets into a centralized platform, including dynamic reporting and other visualizations, tailor key risk indicators, and configurable workflows for risk assessment and ultimately compliance monitoring. On the payer provider side, we equally have a number of key assets and other products that help solve, again, critical issues. I'll touch on one that solves for billing issues. So it's estimated that 80% of all medical bills contain errors, which is really unimaginable when you think about the sheer number of bills that each hospital or other provider must deal with on a daily basis, and even worse, the impact for us as patients. And while hospitals can, dedicate resources to help to scan and prevent the errors, manual intervention can't solve everything, or it's not feasible at scale, which is why PwC created SMART, which is a product that automates the coding quality review process, enabling more efficient, effective, and strategic reviews for providers. So, of course, these are just a few examples of the various products that PwC has developed and continues to support to solve some of those biggest challenges facing the healthcare industry today.
Thank you, Rachel. That's an exciting overview of a portfolio of products there. Taking a step back for a second, from your experience, how do you see organizations and product leadership managing their product portfolio? And specifically, how can product leaders transform their legacy operations, and how can they inject this product-driven mentality so that they can start to create value and demonstrate product potential?
Yeah, it's a great question, Jenny, and hopefully one that all leaders and companies are really asking themselves at this point, because hopefully all companies have realized that they must continue to change and embrace technology, again, in order to be successful and thrive in today's world. But probably what does differ significantly across organizations is where they fall on that technology maturity curve that I mentioned previously. So I think if you look back over the last several years, you'll notice different trends in adopting technologies. So probably historically, organizations found themselves with many disparate custom-built solutions that inevitably had manual processes. They were labor intensive. They probably resulted in duplicative processes across different business units, which obviously resulted in higher costs to not only build, but to maintain. And that really couldn't keep pace with change. Then you saw the introduction and emerging technologies that were introduced across the industry from either boutique type solutions or even large scale products. These, of course, help to solve for part of the problem, but in my opinion, they were really lacking the end-to-end enterprise-wide mindset, and allowing them to integrate with the existing environment and technology landscape that organizations already had, the ability to really operate at scale, and again, just really address that enterprise need from a global perspective. So I feel in order for companies to fully really embrace a product-driven mentality, they must adopt a truly enterprise-wide tech-enabled capability approach. And this doesn't just mean a product, but really a set of capabilities that could consist of a variety of different technologies, but also efficient processes and the use of people. And more importantly, that these technologies integrate with the existing landscape in a cohesive and seamless way to create that end-to-end technology approach for those companies. So again, that goes really well with the PwC approach of the human-led, tech-powered mentality that you have to have all of those in order to really address the technology mindset that we need to shift to. And I think also, though, it's equally important that our organizations and our chief product officers and our leaders, they get stakeholder buy-in and support from the beginning of all projects. And this has to include all different areas and business functions across the organization. If you're just implementing technology or capability that solves for a compliance issue, it's probably not going to help your commercial function or your medical function. So it really has to provide and demonstrate value, not only for the enterprise, but equally to be able to demonstrate value for each and every stakeholder across the organization. And I think the last point I would mention is technology investments probably previously were viewed as an increased cost to organizations. And I think, it's important that leaders transform the opinion to be able to highlight instead of the cost of the investment, rather the cost avoidance that the technology and other capabilities or changes will provide the organization, and how they can ultimately free up time, money, resources to focus on delivering higher value work, which is ultimately the goal, and allowing them to help deliver on their critical missions, rather that be, providing life-changing medicines to patients, or providers being able to see and help more patients with better long-term health outcomes, or payers helping to lower the overall cost of healthcare to the public. So I think really to sum it up, the healthcare industry, as well as all industries, really have no choice but to go ahead, embrace and embark on this digital transformation journey in order to continue to thrive in this increasingly challenging world in which we find ourselves living in today.
Thanks, Rachel. Very helpful guidance and a really compelling picture. Good to hear for the organizations as they ponder their digital journey and ways to become more product-centric. And also excited to hear about our suite of products. You mentioned Flex Connect, you mentioned the Compliance Suite, Smart, all of these things that help bring about the connected health ecosystems that we keep talking about, and also make them more connected, more secure, lower risk, ultimately more affordable and equitable for the consumer. So really appreciate the conversation and sharing with us some of the efforts that PwC is putting in.
Great. Thanks again for having me. Appreciate it. Enjoyed the dialogue and look forward to continuing it.
For more on these topics and other health industry insights driven by policy, innovation, and care delivery changes, please subscribe to our Next in Health podcast. Until next time, this has been Next in Health.
This podcast is brought to you by PwC, all rights reserved. PwC refers to the U.S. member firm or one of its subsidiaries or affiliates, and may sometimes refer to the PwC network. Each member firm is a separate legal entity. Please see www.pwc.com/structure for further details. This podcast is for general information purposes only and should not be used as a substitute for consultation with professional advisors.